Hello everybody and welcome back to my channel. Today I will be doing a 30-week pregnancy update. Finally coming back to you guys with another update. I really haven't been doing pregnancy updates, but I wanted to just check in and let you guys know how I was doing. I want to talk about the 3-hour glucose test because I didn't pass the first one, but before I get into that, I just want to jump in and use the baby center app and let you know the stats of the baby. Right now I am 30 weeks. I will be 31 weeks in a couple days. The baby is a size of a large cabbage. It says your baby is about 15.7 inches long and weighs almost 3 pounds. I feel like more than 3 pounds right now. Just let me back up for a second so you guys can get a shot of my belly. This is how big my belly is right now. I was this size when I gave birth to Caleb, so it's definitely different from my first pregnancy, and I have 10 more weeks to go. Hopefully I don't get too much bigger, but we shall see. How I've been feeling, I've been feeling very easily irritated, and I'm usually pretty patient when it comes to people and my family and my toddler, but lately I've been just very impatient. I just chalk it up to the hormones. Even with Caleb, my son, you know, he's a toddler. He's very high energy. Sometimes I feel bad and it's not a good feeling. So I try to keep my emotions in check and make sure I'm not overreacting to things, especially him. I'm trying to enjoy this time with him while it's just him here. That's one thing that I've been dealing with. So I want to go ahead and talk about the glucose test, which about 27 weeks I went in to take the 1-hour glucose test. I did not eat anything sugary like that the day before. I followed the fasting rules and everything, and I failed miserably. Does that sound right? I failed. I had to come back the next week and take the 3-hour glucose test, which I was not looking forward to. I was very nervous and I didn't want to be stuck in the office for 3 hours. But I had to go take it. What happened, you know, when we first got there, they took my blood before I took the drink. They took my blood a total amount of 4 times. So they take your blood before you take the glucose drink. I drank, I want to say 5 ounces of the drink, and then they waited an hour, took my blood, waited another hour, took my blood, waited another hour, took my blood, and that was it. The hardest part is just I had to go that whole time without eating, and I had to fast before that. So literally from 8, you know, the previous day, 8 p.m. the previous day, to 11:30, you know, in the afternoon, I did not go without eating. So I was very tired and I was very hungry. And the nurse did say there are stories of people passing out when they take the 3-hour glucose test because they, you know, haven't eaten. Where my doctor is, it is in the hospital, so I was able to eat something because they have a little food court area. It's a very nice hospital. So I just got something to eat real quick, hit the road. So they called me back and told me that I actually passed the glucose test, so I was very happy about that. It's a very nerve-wracking thing because you're like, what do I do? You know, if I fail, you know, I gotta, you know, watch what I eat, which I still, you know, have to watch what I eat. But when I failed the first one, it was I didn't want to eat anything. Everything, I just saw sugar and carbs, and I'm like, no. So, but I'm glad I was able to pass that. and everything went good. Another thing I want to talk about is I've been having contractions, and I honestly, it's hard to differentiate if they're Braxton Hicks contractions, some real contractions, simply because I did have Braxton Hicks with my first pregnancy with Caleb, and they were uncomfortable, but they were never painful or too strong or anything. But these contractions are like legit strong. There is like a slight tinge of pain. I did not have that with Caleb, and most of the time they come like if I vacuum or if I go grocery shopping and then come back, I'll sit down and they'll like come for like an hour. Did mention it to my doctor. He said it could be Braxton Hicks or it could be dehydration, which I won't rule out dehydration because I'm pretty sure I haven't been drinking as much water as I should be. So I'm gonna try to really amp up my water intake and do better with that. Maybe that will help a little bit. So I'm the type of person, you know, I live in a small space. Like if things get too cluttered, it kind of drives me a tad bit crazy. So, you know, I try to do a little bit at a time and take a break, and then do a little bit at a time, then take a break. So I'm trying not to overdo it, and yes. So that is my 30-week update. I am a little out of breath. I wanted to record this video before Caleb woke up because he was taking a nap. And I'm sorry that I've been MIA. It's just been really tough trying to record, but I'm trying to push through and stick with it. But thank you guys for watching. If you have any questions or video requests or anything like that, please leave it in the comment section below. Make sure you like this video and subscribe if you want to see more pregnancy updates and just more updates in general about, you know, my labor and delivery and things of that nature. So I will see you guys in another video.